everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me again is Dr. Patrick Woodard. The first time we talked to you, Doctor, was back in episode 46, and I think that was kind of a general overview about what we're going to get in today. Yeah. I think. So glad to have you back, Doctor.
I can't believe it's been like a year.
I know. It's been a long time already. You are the Chief Healthcare Information Officer.
Correct.
For Monument Health. You're an MHA, which is a Master of Healthcare Administration, correct?
Yep.
Doctor, of course. How did going from a doctor leading into this, how did you get here in your career path?
It's a great question, and one I get kind of a lot, actually.
Yeah.
It was by mistake. I'm very happy to be here now, but it was one of those kind of things where I saw a problem that needed to be fixed, and I had dusted off some old technology skills, started a company to solve that particular problem, which was a patient safety and quality problem. And like many things with technology, they tend to bloom beyond where they're initially planted and grow kind of like a weed into something else. And so through the growth of that company, I learned just how powerful the impact of technology is for caring for patients. For me, that meant that I practiced as a hospitalist for many years, that I could be at many bedsides at once instead of just being at one bedside and then waiting and going to the next bedside. But through the impact of technology, I could grow that impact and be able to say, look, we know that we're providing better, more safe, higher quality care through the use of technology. And so by taking that kind of clinician's lens and applying it to how health systems and hospitals apply technology, we're able to really care for a whole community in a broader reach kind of way.
Well, and I think the technology that is on everybody's mind too, and one reason why you're in here today is because of this explosion of artificial intelligence, or AI, that everybody is getting super familiar with, right? And there's been the cliche, quite a bit, especially I think in the medical field, of this next piece of technology is this the future of medicine, right? Looking at AI, do you consider this to be the future of medicine?
I guess the short answer is yes. I think the longer answer is yes, but it's also our past as well. Medicine and healthcare in particular has been a leading adopter of AI or artificial intelligence type tools. They don't necessarily look like what people are currently perhaps thinking of when they think AI. Right now, people will think, well, artificial intelligence is a chatbot where I can go and ask a question, or it can make me a pretty cute picture of a panda flying an airplane or something like that. That is, I think, the most recent iteration of artificial intelligence, and something that people are able to easily grasp. But the use of technology to do artificially intelligent tasks in healthcare has been around for really, half a century. I think if we look back into history, the EKG machine has been around for 70 or 80 years, and very quickly doctors realized that there are patterns in EKGs that can be recognized by applying algorithms to those types of strips. So in the mid-70s, hospitals and pretty much anybody who used an EKG got a machine-read diagnosis of what that EKG showed. It's just an algorithm. It's looking at patterns. It's doing pattern matching, and it says, the early ones said heart attack or no heart attack,
right,
which is important, but there's so much more detail and data that's included within an EKG. And so now, when you go through medical school, your attending physician will hand you the little printout, which is still printed out, and they'll fold over the top, because the top is where the machine diagnosis is written, and they'll hand it to you. And you're not, as a medical student, you're not allowed to look at the machine diagnosis, which is really designed to create a culture or to avoid over-reliance on the machine, because it's wrong sometimes. It's not wrong often, but it's wrong sometimes. And you want to be able to have your own interpretation of a piece of data, which in this case is an EKG strip, before adding on the machine component. You want the machine's interpretation of that algorithm to be one piece of data that you're using to make a diagnosis, not the whole thing. And so I think that's really representative of where we are in healthcare overall. It's another piece of another tool for us. It's another piece to provide initial layers of safety and quality, to provide kind of a reassurance that we're maybe making the right diagnosis, or if it disagrees with us, to maybe question that and to say, hey, are we missing something? Is there something else we should be considering? But it's not the whole kit and caboodle, right? Just like you wouldn't want to replace your entire marketing staff with ChatGPT, well, I mean,
No, of course
and you
not.
definitely wouldn't
Right.
want to replace like your financial
Yeah.
analysis team, and you wouldn't want to replace your partner or your spouse with a
Right.
fully automated creation either. There's a lot of humanity that goes into healthcare, and so it's just another component that we're adding into thinking about how do we provide consistent, safe, high quality care with all of the available tools at our disposal in ways that make sense and that are patient-centric.
Well, and I think that's what a lot of people, probably one of the big worries when they hear the term artificial intelligence involved with medicine, is they're thinking, well, pretty soon, because we've done lots of these podcasts on the robotics too, that the hospital uses. And so people think, well, where's the doctor? You know, the robot's just going to come in and
he's behind the bed,
Right.
He's right there in the same room.
Exactly. And I think artificial intelligence, this is the same thing in essence, isn't it? You still need the interpretation of that.
You do. And, I think right now, maybe we'll get to a place in the future, at which the computers are way smarter than the doctors. And maybe most of it's diagnostically done by a computer, but you're not going to ever take a human out. I can't imagine a world in which we take a human out of the loop. Maybe the computer is the one that diagnoses you with breast cancer, but do you want the computer there to answer your questions? I don't think so. I think you're going to want to talk with someone who's an expert, who has 20 years of experience, or even just right out of residency, but someone who's a human, who's sitting there with you and saying, here's what you can expect, here's what we will go through together as humans, as people, as part of your care team. And so, yes, there will be growth. Things will get better. We are not there yet. We're at a place where we're adding in these tools as improvements, tools that help us make sure that we're delivering better, higher quality, more safe care. But they're tools, right? They're just an added part of your toolkit.
Well, it seems like it will make the doctors. It seems like it just helps make them smarter, for lack of a better term as well, right? Because they have even more of that information right at their fingertips that they can look at, analyze, and maybe think of something that they didn't think of originally, and then they just put that in their toolbox for next time.
I think it makes them smarter. It makes them nicer. And I'll tell you about that one in a minute. It makes them more present, whether that's because they're actually able to have a conversation with you and not have to spend the entire time taking notes. It makes them more conscientious about things that they could be missing, like you said. So I think all of those things together, maybe a single tool may not do all of those, but if we can get part of it, I think that's a win every time. So I think from that perspective, it's an enhancer of the human experience that you're already having.
Now, another kind of one of these specific applications, you talked about the EKG analysis, which it was so interesting to learn how long that has been technically using AI. Almost from the very beginning of the machine. And for people that have never had an EKG, you simply lay down and you're attached with electrodes in various parts of your body, and it takes all of, I don't know, a couple minutes.
6 seconds, technically.
Okay. To read all of that and get it printed. And it can tell you, like you said, it can tell you, or it can look and see whether you've even had a heart attack. It can let you know that kind of information, how everything works now. And going down that same path, when you're talking about heart issues, we can move into stroke detection. Is another thing that I think AI is helping out with, correct?
Yeah, and this is in addition to being smarter and kinder, this is a time thing, right? So if you have a stroke, there's a saying, time is brain, and really that goes to every second or minute that your brain is not getting oxygen, that's a period of time where your brain tissue is effectively dying, which is not great, in fact. You want to avoid that as much as possible. And so the faster you can get to a hospital and the faster that you can have an intervention done, if you're eligible for an intervention, meaning clot retrieval or medications to help burst a clot or dissolve a clot, that's a faster recovery time. That means that you may have no symptoms after that intervention, whereas if you did nothing, you might be paralyzed on half of your body, for example. And so by using tools that So what typically happens in a stroke is a patient will come in complaining of stroke-like symptoms. Maybe it's weakness, maybe it's facial droop, maybe they're slurring their words, something like that. The doctor will have a suspicion that it's a stroke. It might even happen in triage, and they'll go immediately back to get a CAT scan. The idea behind that is, as soon as you get the images to determine whether or not it's actually a blockage or not, you can make a determination of, do I use the clot-busting drugs that dissolve the clot, or do I call the interventional radiology team and use a retrieval device to actually physically go in and pull that clot out, which is the gold standard, and that's what you want to be able to have if possible, but you can't do that if you don't know about it. And if you wait too long, there's not any benefit to pulling it out because the brain tissue is already dead. So by adding an AI tool into the CT scanner directly, as soon as those images hit the CT scanner, there's a machine reading that and saying, it looks like there's no blood flow to this part of the brain. It matches our patterns for other strokes that look and have similar imaging. And so therefore they're able to send out, the machine is able to immediately send out that alert to our stroke team, which is able to activate the stroke team much, much faster than waiting for the images to be uploaded, sent to the radiologist, who they do get alerted quickly, and they will read those images too. But if you're talking about a machine who can do it instantaneously, or a radiologist who takes, anywhere between 10 and 15 minutes, I'd want the one that's happening immediately, right? I want the radiologist coming into the hospital. I want the pharmacist getting the drugs ready to make sure that I can actually get them. I want the doctors asking me to double check my medications and make sure that I don't have any contraindications to that therapy. And so if you're thinking 10 or 15 minutes, that could be the difference between you being able to walk out of the hospital or having to go to a skilled nursing facility. So huge advantages in terms of just being able to deliver high quality, fast, and really human-centered care because of a machine, which is something that you don't think about because it's ultimately still a human relationship that's occurring, but that machine adds 10 or 15 minutes, which might add years to your life.
That's amazing. It really is. Just to watch even in the years we've been doing this podcast, to watch the advances that have happened over a couple of years has been fascinating. Going down, you mentioned a little bit about earlier about you've used the word care when it comes to AI too. And I think one thing we were talking about before the podcast started, which I never thought of, which I thought was a brilliant use of this, is when you are in the room spending time with the doctor. Sometimes when you're sitting down with a doctor, they not only have to sit in front of a computer, listen to you, enter information, and still try to listen to you.
And hopefully catch everything you
said.
said.
Right, exactly. Yeah. To where sometimes you might feel like, well, I'm trying to tell him what's going on, but he has to enter everything, or she has to enter everything. Are they listening? Are they paying attention? AI has a pretty unique opportunity here, doesn't it?
It does, in fact. And, it's something that we've started doing about 6 months ago. We put in a tool that allows for our doctors to basically just set their cell phone in the room with them, and it listens. That's all it does, is it just listens to the conversation, and in the background creates a transcription of the conversation, and then summarizes that transcription into what the doctor calls the note, right? Your progress note, your clinic note, whatever. And although the note is important, what really matters is the conversation, right? Because you may come in for a diabetes check, or maybe you're concerned about your cholesterol, or maybe it's a follow-up on your cholecystectomy. You had your gallbladder out, something like that. And the ability for the physician or practitioner to be able to sit across the room from you and pay attention with their whole intention, and rather than having to take notes and hopefully catch everything you said, because, let's be real, taking notes is great, but you're going to miss something.
Right.
Just realistically. And so the idea being that if you can capture more without saying, hey, can you repeat that? First of all, it makes you feel like they're actually listening. And secondly, the machine doesn't get tired. They're not going to be worse off after lunch because they're a little bit, or maybe right before lunch because they're hangry.
Right.
You don't know.
Exactly.
And so the machine's diligently taking notes and then putting those in a format that the doctor can use to create their note. And so that is another way that I think it enables the ability for us to communicate as people, and less about, well, I have to worry so much about taking notes. Because ultimately what the doctor wants to know is, what's going on. What I want to listen. I want to hear what's going on. I want to put all the pieces together. We'll come up with a treatment plan and a good plan for follow-up and all of that. They don't really care about the note for the sake of the note. It's necessary to remember next time they see you what happened, but it's mostly about like, let's talk and let's be human together. So the more that we can enable that, I think the farther along we can get just societally.
Yeah.
We tried something that didn't work as well as we were hoping, but I think it's worth talking about anyway. And so in one of our clinics, I won't tell you which one. God, I don't want to out anybody. We tried putting generated draft replies to patient messages that they were sent through MyChart, which is our patient. So you can send your
It's a great portal. If people don't use it, you should. Yeah.
Love the pitch.
I love it. Yes, I do.
Always great. So if you sent a message to one clinic, the doctors had the option of choosing to send a robotic reply from basically a ChatGPT-like response that took into account what the patient was asking. Maybe it was a medication refill, maybe it was a question about their treatment plan or what have you, or they could choose to write it themselves. Now, we ended up not using it because it turns out that it wasn't as accurate as we were hoping. It didn't save the doctors any time. But one thing we did notice is that all of the doctors said that it made them nicer. It made them more empathetic. So maybe a patient would write in and say something like, well, my back's really been hurting. I was hoping that I could get some medication for that, or do I need to come in? And the doc historically might have just said something like, yeah, come in, we can get you in next Tuesday.
Right.
Not wrong, not a bad
Right.
response.
No, of course.
But what the robot would have said was, I'm so sorry to hear that about your back. I know that you've been struggling with that for a while. Let's see if we can get you in as soon as possible. I think next Tuesday we have an appointment opening, which is same overall message said completely differently. And part of the reason that we don't feel that we need to keep doing that is that the doctors had incorporated kind of that empathy into their same tone, right?
Yeah.
Into their own messaging, even when they weren't using the robotic generated text. So I think it's a good example of us being able to iterate and learn what's working, and let's not put anything in if we don't need it. But if our doctors can learn to be a little bit more human by something that they're learning from an empathetic response from a machine, I'll take that.
Right. Well, we all know, too, with hospitals and doctors, paperwork, I mean, it's overwhelming for medicine, right? It has to be. Is this going to be kind of a game changer for that in a way, too?
I think it will. Some of what we're doing is around what we talked about with the kind of what we call ambient scribing.
Yes.
So the documentation that kind of happens while you're sitting at a clinic visit. Another tool that we're putting in that we look forward to using in our hospital settings is one that will capture diagnoses that maybe the physician missed. Patients who are in the hospital tend to be fairly complex. They tend to have, you may come in with pneumonia, but that's not the only thing that's going on. You're also the sum of all of the other parts of you that was there before you walked in the door with pneumonia. So you have to manage their diabetes and their blood pressure, and maybe they have Crohn's disease, and all of those kind of things that you need to be able to keep track of, because you want to take care of that whole person that's in front of you, not just treat the disease that walked in the door. And for some patients, it just becomes increasingly complex. And so another tool that we are putting in will enable us to say, hey, doc, did you notice that the patient's sodium is low? Is there anything you want to do about that? Types of things that everything is being managed, and we're still delivering high quality care, but adding another layer of just making sure that you don't miss anything.
Yeah.
We talk about like the Swiss cheese effect, where mistakes tend to happen. There's so many layers, safety layers in place. And so when mistakes happen, they're infrequent, but when they do, it tends to happen because there's one hole in one slice of cheese and another hole in another slice of cheese. And all of these are safety layers, and the holes just tend to line up.
Yeah.
So the more layers that we can put in to provide a higher quality and better, more safe environment, I think the better quality care that we will deliver, but also it just makes people feel more comfortable.
Sure.
And so this is another one of those. But the downside, to answer your question, the kind of like downstream impact of that is that it will reduce some of the documentation burden for the providers, which isn't the reason we're doing it, but it's a nice side effect.
Right.
And, on the very back end of things, if we're thinking about getting bills and looking for accuracy, there's a large number of just the bills that we send out that get rejected from the insurance company for any number of reasons, good ones and bad ones. I think mostly bad ones, but hey,
Sure.
you know, I said. And so from that perspective, we're looking at things that can say, hey, we don't want to get it, because, you know, it's frustrating for you as a patient to get a bill 7 months after the service was provided. Yes. And you don't know that half of that time or more of it was spent going back and forth with the insurance company about something that you should have been covered for, but the insurance company says no.
Right.
So our goal is to make sure that people are getting the right kind of coverage that they deserve and are paying for. And so are there tools, and we have a couple of ideas here, but are there tools where we can limit the number of denials or improve the kind of relationship that we have with the insurance companies, just so that we don't have to do as much back and forth and paperwork, and overall, ideally, lower the cost of healthcare in this country?
Right. Well, as people are listening to this right now, obviously there's lots of positives and upsides to AI. I personally don't think people should be afraid of it. You know, we use it a lot in this business too, especially when we have to write as much as we have to write.
I'm sure.
You know, there's a lot of great instances for it. But for somebody listening to this podcast right now, Doctor, what is one? I mean, if you could just reassure them about one thing about AI, what would that be in your mind? What would something you'd like to say? Look, don't be scared.
Yeah. So I think there's a couple thoughts here. Number one is we've been doing this for a long time.
Yeah.
It's baked into the culture of healthcare that we want to take advantage of new technologies as they come out, whether that be new medications or new procedures or new technology solutions like AI, but we do it in a very thoughtful and measured way. I mean, I think even the fact that my very first EKG that I read as a medical student was handed to me with the diagnosis hidden, which goes to the overall culture of healthcare being skeptical of new of things that you want to be able to ensure that you're making a decision correctly. Decisions in healthcare are life or death. They have a long downstream impact on what a patient's life would look like,
right.
Whether that be going home and being fine, or maybe not going home at all, or having a long protracted illness. And so it's important for us, both as physicians and then healthcare leaders as well, to make sure that the tools that we use are done so in a way that is thoughtful and one that isn't just kind of reactive. You know, I kind of cringe a little bit when we get asked questions about AI, because most people are thinking about Gen AI. So
yes.
ChatGPT, Anthropic, Gemini, Bard, all of those. And that's cool, and it's very buzzworthy right now. And we do look at those. We are considering, like the patient messaging one, use that kind of technology. And it didn't work. And that's okay. There was still a human in the loop. Every one of those messages was reviewed by a physician, your regular doctor, by the way.
Right.
And when it didn't work, we stopped using it. So I think those are the types of things that I would say we're very cautious about. If we're going to take something new, it has to have a benefit over what we're doing today, and not just do it because it's buzzworthy or hyped. So I think if there's anything to take away from this, it's that we do want to progress, absolutely, but we want to do it in a way that's safe and reassuring for patients and for their families.
Now, on that first EKG that you read, did you get it right?
Oh, probably not.
Dr. Patrick Woodard is the Chief Healthcare Information Officer for Monument Health. Thank you for coming in and talking again, Doctor. I really appreciate it. And, the next big leap forward, let's do it again, okay?
Absolutely. It's my pleasure.